Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe. I'm founder and editor of Kevin MD. Today on the show, we have Ruchi Vikas. She's a psychiatry resident and graduating very soon. And she wrote this Kevin MD article, Emergency Psychiatry During COVID-19. Ruchi, welcome to the show.
Thank you so much.
So tell me about your story and your journey to where you are today.
My parents were both state psychiatrists at the last state psychiatric hospital in Brooklyn, Kingsborough Psychiatric Center. Kind of pretty much always knew what I wanted to do. And I'm completing my psychiatry residency here at Stony Brook after spending a lifetime around the severely persistent mentally ill. In 3 weeks, I'll go to Bellevue at NYU and start working there as an emergency physician.
Wonderful. And I think that your services will be sorely needed, especially in a hotspot like Bellevue. So you wrote a Kevin MD article, Emergency Psychiatry During COVID-19. So before I get into that article, you talk about a comprehensive psychiatric emergency program. Can you tell us what that is?
So it's exclusive mainly to the northeastern United States. A lot of places have different versions of this, but what we have is a locked psychiatric emergency room. So once you come in, you can't leave in any sense until you're evaluated by a physician or really by the team. And people come when they're perceived as being a danger to themselves or others. So sometimes family brings people in, sometimes patients bring people in. They can be referred in, and they're very often brought by police.
And during COVID-19, during the pandemic over the last 3 months, describe what have you been seeing?
It's been all kinds. I mean, we always get all kinds because we are the only CPAP in Suffolk County, so we get a lot of people. But for us, a lot of people have called saying they're suicidal. A lot of general practitioners or other physicians that those patients see have called us and said, I had a phone call or I had a telemedicine call with this patient. I'm really worried about them. They don't seem to be doing okay. And police have been bringing a lot of people in for public intoxication or just people we've all seen psychotic people in the streets. I don't know the statistics, but I think that there have been more in the past couple of months because we have gotten more.
And when they come to your institution, what do you do for them?
They come in and they change into scrubs and they kind of wait to be evaluated. CPAP was initially meant to be therapeutic in itself. So patients were supposed to interact and socialize within the big milieu area. Sometimes that happens, other times it gets crazy. But while they're waiting to be seen, we kind of watch to see how they interact and how they're doing. You can tell a lot about a person just by looking at them. And then when we do the interview, we're really trying to ascertain if they are a danger to themselves or others. So if they can go home safely and take care of themselves without hurting anyone, and especially without hurting themselves. And if they can't, we admit them to the inpatient unit, which has been a challenge in of itself because so many psych units have been closed due to the pandemic.
And how has access been?
It's been okay. People stay maybe a little longer than usual, but for a while the census in CPAP was lower than usual because people weren't really going out. They were utilizing the suicide hotline a little more. Now it's picking back up, but now also a lot of psych units, inpatient units have opened back up too. So it's been better, but it's been kind of a puzzle piece figuring out how to get everyone where they need to go.
So I'm reading a lot in mainstream media about the psychiatric manifestations of social isolation and coming out of the lockdown. So over the next 3 months or so, what are some of the psychiatric issues that you see are going to be prevalent in the public?
A lot of drugs and alcohol. Drinking has become normalized because there's no routine to time. Also, all of the people who are experiencing a lot more domestic violence, and they're going to be struggling and traumatized from the amount of time they've potentially spent in an abusive relationship. Plus, just people's natural anxiety has increased so much. Never in my life have I seen more than a few people coming in for the same reason in the same day. One day in CPAP, we had over 4 people come in for attacking someone for not washing their hands properly.
Oh. So I'm in primary care. I do internal medicine in Nashua. So I do a lot of virtual visits and telemedicine, and now I'm seeing more and more patients in the office. Now, from a behavioral health standpoint, what are some of the things that I can do to help mitigate some of the psychiatric effects of the pandemic?
That's a great question. One thing that I wish primary care any physician really would do more of, including us, including psychiatry, is just ask how you're doing, how are you, but not in a dismissive or cursory way. Not that you do that. I find myself doing that at times.
Sure.
Just how are you, and let them answer, and then engage with them on a narrative and personal level, which sounds like it'll take a lot of time, but doesn't usually. So, what was the last thing that made you laugh? When was the last time that you laughed? How has your anxiety been today? We ask a lot of the questions that we have to ask, like, are you feeling suicidal? Do you want to hurt yourself? But sometimes those can be yes or no answers, or they can be more below the surface. If people feel seen as human beings right now, as someone with a story, instead of just lost in this blanket of lockdown and isolation, it might help. We never realize the smallest things that we do for people that make them feel better. So if you ask someone, when was the last time you laughed? They'll remember it, or they'll remember that it's been a while. Just recognition of someone as a human, even briefly, means so much to people. I know, because it means a lot to me too. So
Well, thank you. That's great advice. So I'm also reading about mental health issues or behavioral health issues within the healthcare profession as well during the pandemic, especially with frontline workers. So I was wondering if you could comment on that. And again, what are some things that we can do to help them?
I have seen a couple of healthcare professionals on the other side of CPAP. There have been a few people, not that I knew personally, but that have been in the career before, who have come to CPAP, who have broken under the strain, because there's this tremendous responsibility that we're not doing everything that we can, that we could be doing more, and that we don't have the resources to do our job the way that we usually do. The stories I've been reading about what people are going through in the city, I imagine that this sense of guilt and sense of failure and sense of personal responsibility is heightened. So just asking, the same thing as for patients, because we're not different, just asking people how they're doing, connecting as a human, asking how frustrated do you feel, how are you coping. Being there for someone doesn't necessarily have to mean answering the phone at 3 a.m. It kind of means just looking someone in the eye and seeing them for who they are. You can do that with anyone briefly. You can't do it in an extended period, but if you do it more often than not, then I think you're doing your best.
And I think that's one of the things that I try to emphasize on Kevin MD, and by sharing stories behind the scenes, is that we in healthcare, we're all human too. And I think that sometimes gets lost in the media narrative. So saying that healthcare professionals, that we are human too, and that we have a human side, that's great advice. So how do you see the pandemic playing out in the next few months or so? I know that a lot of states are slowly opening up. We have a little bit of a piecemeal way of opening up. There's no national strategy, but what's your take in terms of the summer and beyond?
I wish I knew. I wish I had a better idea. I mean, I have so many friends across the country, and I'm watching them go out and camp and hike and hang out with all of their friends. And I'm here in New York, and we still can't do anything.
Yeah.
So, I mean, our CPAP census is picking up. And the second time that we go through this, I think we're all going to know what to expect. And I think I worry that the places that didn't get hit as badly first will get hit badly the second time, because they didn't get hit as badly first. And as for mental health, how many times can you go through the same thing? It's going to tell us a lot about who people are. Are you super resilient, and the second time you go through it, you're acclimated to it and it makes you stronger? Or the second time you go through it, you think, I just can't do this again. Neither is wrong. Both are understandable. Are we going to see more of one than the other? I don't know. We've been seeing a pretty even mix of both. I mean, there was this grocery store employee a couple months ago, and she said to me, I just want this to be over. And that was 2 months ago.
Yep.
It's nowhere close to over.
And I have to agree with you there. So I'm seeing a lot of studies saying that if this was a baseball game, we're only in the third inning. And that may not be what people want to hear, but we are in this for the long haul. So tell me something that you're passionate about right now, something that you're curious about right now.
I'm really passionate about stories. So I have a really unique window into people's lives as a psychiatrist, because people trust me with their secrets, and not just people in the emergency room, people all over the place trust me with their secrets. And so I know people from a very deep level. One of the challenges, I think, of residency and of just being a physician overall is becoming hardened or numb to the stories that people have because, RVUs and time and documentation and prior auths. But I found that if you see people for who they are and you just ask them a couple questions that they maybe weren't expecting to be asked, they give away really unique parts of their personality that you would never have known and that they take for granted. So I have this like schizophrenic patient who's much older than someone that you would usually see in that population. It would be easy because she's so cranky to kind of dismiss her and just do the visit as routine. But I found just by asking that she cooks meals for all of the homeless people around her block once a week. And I never would have known that if I hadn't have asked. And she wouldn't have known to tell me because she doesn't think it's a big deal. So I'm finding those stories much more interesting than any risk factor or anything that I could do algorithmically. And I'm finding the most efficient and best way to get at those stories, especially in a targeted amount of time, because in an emergency room, you don't have that much time. But that opportunity for very human connection is what I'm most passionate about now.
Well, thank you for sharing that insight. And my final question, what's your take-home message for the Kevin MD audience?
I would like everyone to just kind of be human and be connected with one another, because even in the Kevin MD article I wrote, what we see in the world and in CPEP is just a lot of division and a lot of people arguing because they don't agree. And we're not ever going to agree on everything, but if we can find one moment or one space to connect on in between, it might be better for everyone. I'm working on a book proposal right now that talks about the ways that we can find connection with people that we don't agree with. The art of gentle disagreement and confrontation, I think, has been lost. And part of psychiatry's job is to instill that back into everyone, the ability to respect and communicate equally with everyone. Because what we need right now is unity and humanity.
Well, given today's political climate, and I'm going to be looking forward to your book.
Thank you.
Well, thank you so much for joining us on the show. Dr. Ruchi Vikas is a psychiatry resident and soon to be attending. And she wrote this article on Kevin MD, Emergency Psychiatry During COVID-19. Thank you so much for joining us.
Thank you so much for having me.